And we're live. Good morning or good afternoon or good evening, depending on when you're watching. This is the Healthcare Thought Leadership LinkedIn live show with Marion Spears Carr. I'm so glad you're here joining us on a Tuesday. Today's topic and guest is one that I've been so amazingly excited about having. Today, I have entrepreneur, basically one of the groundbreaking leaders in healthcare and all different topics, all different segments of digital health and other areas, co-founder of Teladoc and just an adventurer, Mr. Michael Gordon. Michael, thank you for being on the show today. How are you doing?
I am having a great time. It's sunny and perfect weather in Texas right now.
Well, that's outstanding. And for those of you who don't know, I'm in the mountains of Georgia and we have been through some storms, but it's perfect weather here too. And it is, Michael, you and I connected because of a lot of different reasons. I'd heard you speak multiple times. I know a lot of people that are watching the show. And by the way, if you're watching the show live, please post in the comments. Let us know where you're watching from. We always want to know who is in the audience. And please feel free to post in your comments any questions you have for Michael. You and I connected. I got to hear you speak a couple years ago. And we got connected recently to talk about this, one of your newest ventures called Sensei, this amazing platform that is being developed to help improve dramatically the level of diagnostics for people with mental health. But first, Michael, I'd love for you to talk about, just for audience who might not have the chance to know who you are, can you give us a little bit more about your background? Because it's so fascinating. I'd love for you to talk about that, and then we'll jump into the conversation about Sensei.
Well, just real briefly, I'm an Air Force brat. My dad was a sergeant, and we traveled all around the world. And so when you travel around the world, you become either a nerd who hangs out in the bedroom reading all the time, or somebody who knows how to become social and make friends every 18 months when you move. And I got a little bit of both. And so, but I also, when I was quite young, decided I wanted to be the first man on Mars. And to do that, I thought I need to be an engineer, a scientist, and a medical doctor. And so that started the trajectory for insanity.
What, and you have a law background, you have a physics background, you have all of these different pieces, and it all ties into that love of science. What was it? I guess, Michael, I wanted to talk about you. We mentioned Teladoc earlier, but you were early in the work being done to improve virtual care. What was it that got you excited in that space, that drew you to that side of science? I would love to hear a little bit about that, because I think it ties right into what we're going to be talking about this new venture that you have.
Well, the origins of Teladoc happened when I left a company that I had built in the 90s. We had a nice $122 million liquidity event and called a bunch of friends and said, I'm going to climb Kilimanjaro. I'll pay for everything. And Dr. Brooks, my co-founder in Teladoc, was a medical doctor, electrical engineer. He had been working at NASA taking care of astronauts in outer space. And he just said, hey, Michael, you make more money in one transaction than I'm going to make in my entire lifetime. And so while climbing Kilimanjaro, we dreamed up the idea of Teladoc. And as innovative as it was, I now know the actual idea started in 1968 with a guy named Jay Sanders, who I co-authored. Whoops, everything is backwards here. That book right there, Digital Medical Helm.
Yeah.
I'm still not used to the mirror image.
Yeah. Yeah. So tell me, and one of the things that was, when I was studying and learning a little bit more about you, is all the writing that you've done, both nonfiction and fiction. How does that, tell me a little bit more about that book that you co-authored, because that's an interesting tie to this. Tell us a little bit about that.
I love that book because Jay Sanders is in his mid 80s now. And I called him and said, hey, let's write a book. Everybody calls him the father of telemedicine. And he said, and his comment was, Michael, we better write fast because I'm really old. And so he did. And I think we knocked out a really great book that is much more historical than anything else. He and I are talking about writing a second one that really gets into the weeds on how you fix problems. But we tell the stories from 1968 all the way through when the boards of medical examiners were telling me I was going to go to prison for building Teladoc.
Oh wow. That's a story we ought to unpack sometime as
Yeah.
well. The
Yeah.
checking in the comments, it's good to see Kevin Young checking in from Dallas. Mark Kamazine checking in from sunny San Ramon, California. And he posted his background. He's quite a science background as well. Frank Hughes checking in from San Antonio. Frank, good to see you. Longtime colleague and friend of mine. And then who else we have? It looks like Aaron Irvin's checking in from Austin. So we've had this amazing collection of Texas connections already checking in. Michael, when I got introduced to you on this particular topic, I was really looking around, trying to learn more about the mental health side of diagnostics. Diagnostics is a world that I work in. For those of you who don't know me, I run a small entrepreneurial program as well, an executive search firm that I just founded. It's my third one, and I specialize in healthcare. And one of the areas I'm interested in is the whole world of mental health and behavioral health. And I found out about this new platform that you were supporting and the science behind it, and it became really exciting to me. And it's called Sensei. I would love for you to describe that. And also, you told me a story in the green room about how you found this amazing, brilliant scientists who created. Can you tell us a little bit about Sensei?
Sure. And by the way, it's really interesting because it's sense, SENSE, and then
Yep.
I, like the eyes. But I'm going to actually go back a little bit farther from where you and I started, Marion.
Okay.
And I want to tell a story about the founder of Sensei, David Zachariah, in high school. He was
Oh
a
wow.
total nerd. He's one of these guys who had a speech impediment and he couldn't even get a sentence out. And because of that, he became a programmer. Obvious place for a genius who can't speak. And he won a contest for a virtual augmented reality device that you put on your head. And they had a trackball on the side of it. And David thought, I'm smart enough to figure out how to do it by tracking the eyes, not
Oh
have a
wow.
trackball that you run with your hand. So he created something. He entered the science fair, and it was so good that the judges thought there's no way this sophomore in high school built it. And so he didn't even get an award. But a Navy admiral was wandering through that very science fair and saw it, talked to David, asked some technical questions, and said, I'm going to give you a Navy grant. So can you imagine that?
No, I
High
can't.
school sophomore gets a Navy grant for the ability to track eyes. And fast forward a little bit, David figures out that he can use blink, dilation, eye movement, and the pulse underneath the eyes to diagnose mental health and behavioral health. And he's now doing it at about twice the accuracy of the traditional method. It's super extraordinary.
That it is extraordinary. And when I started doing my reading and prep for our conversation, a statistic that really shocked me was this idea of the fact that the range of percentages of misdiagnosis in mental health disorders ranges from 23% to 97%. In other words, 1 out of 5 or 4 out of 5 people who have a mental health disorder, it takes years to actually get the diagnosis correct. And one of the things you told me and I read about Sensei is that it's already showing that accuracy and the ability to identify the nuances of the mental health disorder is incredible. Could you talk a little bit about how accurate the the platform already is?
So there's the ability to talk about it, and there's the evidence. And what David said is this is a diagnostic tool. Okay, That's great, except when you say it's a diagnostic tool, it means you have to go through this very grueling process with the FDA.
Mm-hmm.
And for his particular device, there are 3 phases in the FDA. The first one, you demonstrate that it works. The second one, you tune it. And the third one, you collect real data and send your report, and the FDA approves it. So David is done with the first 2. And coming out of phase 2, the Sensei device was producing 87% accuracy in the
Wow.
diagnosis. And you're exactly right. Most of the traditional method is in the 40, under 50% accuracy.
It is incredible. And the other part of what I was reading and what you and I talked about was the fact that one of the areas that Sensei is focusing on is PTSD, and how I did not. I'm familiar with it. I'm familiar with it because you and I talked about it. Um, I'm a brain injury survivor, so I really pay attention to what's going on in the world of brain injury research. A lot of the military professionals that are coming back from Iraq and Afghanistan, or their PTSD is brain injury related. But I was not really, I didn't really understand what Sensei was doing. But talk a little bit about how PTSD is one of their main focuses at the moment, right now, in terms of the research, and then I want to jump into a little bit more about what this looks like on a much broader scale as well.
Right. And just for clarity, the Sensei device is really simple. It'll end up as a software as a service, or what we call SaaS.
Mm-hmm.
The great news is what David and his team have figured out how to do is to put it on a cell phone, which means it is now in the realm of telemedicine. And as a first decision, PTSD was point one of several points. And
Mm-hmm.
so it's a little bit of a financial decision. The reality is, to diagnose, to get through FDA, you have to pick something.
Yeah.
And so PTSD was that something. Every other behavioral health issue will probably also be covered ultimately with the Sensei app. But as you know, getting through FDA is expensive, and David took the
Mm-hmm.
very smart path of, let's do one. And that is the process that will finish up later this year or early next year. And that's PTSD. But right behind it will come every other behavioral health issue. And as it turns out, there are a lot of other things, not behavioral health or mental health related, that you can diagnose by watching the eyes. And I suspect that the technology that David has developed, although right now it is on a smartphone,
Mm-hmm.
maybe in 3 or 4 years, Zoom calls like this one will capture data that can go into the cloud, be diagnosed, and can say, hey, Michael, you're starting to develop diabetes or heart disease or some kind of cancer. I really think the eyes are going to be the mirror into a lot of things that ultimately happen to us.
And there's so much to unpack in that regard. And by the way, just checking in is the person who introduced us directly, John Winling. John, glad to see you in the chat. And if you're watching live, or if you watch the replay, this replay will be available both here on LinkedIn and on YouTube. Please post your comments or your questions for Michael in the chat, because we want to stay connected with you. We want the thing about my little healthcare thought leadership LinkedIn live show is it's a community, and we want people involved and want engaged. Mark's checking in with some comments. He said, here's a question for us: can Sensei be used to diagnose these and objective track treatments? I'll post what he had written, talking about long COVID, some of the challenges related to that, and you just hit on, Michael, that eventually Sensei is going to be able to diagnose some other pieces. Mark, thanks for that question. What are your thoughts on Mark's question?
I would defer to David, the
Yeah.
CEO,
Okay.
but from what I
Yeah.
know today, Mark, thank you for that question.
Yeah.
Remember, diagnosis means FDA. And so we got to
Yeah.
be really careful about what we say.
I
Today, we're
got you.
going through PTSD.
Yeah.
I believe that there will be hundreds of things that this SAS and camera combination will be able to do. And there's a lot of AI also, obviously, behind the scenes, looking at blink, eye motion, dilation, pulse.
You talked a little bit about David's story and the fact that he was able to be identified as a sophomore by the Navy. Incredible. But you told me a story offline around how you actually connected with him. I would love for you to talk about the work you
Sure.
were doing on that book, because that book is of incredible fascination to me. And I can't wait to read it now that I've learned about it. Can you talk a little bit about that?
Sure. The book you're talking about is what I call calamistunity. And I'm a big believer that the bigger the calamity, the bigger the mistake, the higher the grade of opportunity is on the other side of it, if you handle it correctly. Everybody knows the story of David and Goliath. This giant is about to kill this poor little kid who's got a slingshot and or a sling, sorry.
Yeah.
And by slaying the giant, he ultimately becomes one of the most famous kings of all time. Think about that. That is a calamistunity. That's my example. And I think David, by having a speech impediment, not being able to get a word out, and developing a technology like this, he knew he had to learn how to overcome that speech impediment. And at some point, you probably ought to have him on your podcast. Every once in a while, he'll hit a little bit of a stutter point, but for the most part, I see him giving speeches all the time, and he's very smooth, which is, I think, absolutely extraordinary for somebody who couldn't get a sentence out.
And brilliant. And David, I believe you had said you were going to be watching. If you're watching the audience, let us know. And please, I would love to have you on the show. Michael, talk a little bit about more some of the other stuff you're doing. One of the things that was really fascinating to me when, again, researching, trying to get to know you a little bit, was that not only have you written the nonfiction stuff, which we've already talked about, but you because of your interest in space travel, you mentioned you want to be the first man on Mars, and in your physics background, you've been writing fiction. And you have a new book. I'd love for you to talk about kind of how you've went to that direction and how much fun that's been for you. And I think we shared about this when we talked. I'm a massive student of flow theory of psychology. Mihai Csikszentmihalyi became a mentor late for me in his last few years, but you're in flow. I can tell when you're talking about space or talking about science or talking about either in the fiction or nonfiction world, you're fully in flow. So I would love for you to talk about your new book a little bit. I think the audience would be love to hear about it.
You can look behind me. You see a whole bunch of space stuff.
Yeah.
And Buzz Aldrin, who was on that first mission that landed on the moon, became one of the senior advisors at Teledoc.
Oh, wow. I didn't know that.
And so I would call that my own personal luck. Part of the reason the telemedicine industry is around and as big as it is today, because nobody would take my phone call, but everybody will take Buzz's phone call.
Mm-hmm.
So, I have a personal love of science and space, and watching science fiction, reading science fiction, I always have gotten frustrated with the fact that travel to distant stars or other galaxy is almost impossible. And science fiction handles it by saying we're going to go through these things called wormholes or black holes. And as a physicist, I can tell you, you don't want to be anywhere near a black hole. It'll shred you faster than a pepper grinder. And so you're not going to survive getting near a black hole. But there are these really cool things called tachyons that travel faster than light. And I started writing a story, and the story got more and more complex and more interesting. And I thought, something, I think I can take my background of reading sci-fi, Isaac Asimov and Robert Heinlein and Tolkien, and a current one called Rebecca Yarrow, and another current one called Andy Weir, and put them all together and create a story that does something that no sci-fi has ever done before. And so that's the goal. It started out as just entrepreneur writing a book, trying to tell a story. And the more I did it, the more I worked on it, the more I thought, man, there's something here, something that can uplift science fiction to a whole new level.
That's I'd love to see that how you made that transition and how you connected all these loves into the writing of that book. And if you think about it, for those of us who grew up when we did, the sci-fi days of, particularly Star Trek, the original Star Trek, a lot of things we see that are on Star Trek, let's face it, we have them now. I mean, like that technology is there.
Yeah.
Like, and they were just, he was just writing about it, and really, really interesting. But I want to come back and talk about Sensei again from the challenges healthcare people are going to have. I know you were talking about the FDA approval piece, which is critically important here, but talk to me about, or my audience, a lot of my audience, for those who don't know, are mostly healthcare delivery people. My world is in hospitals, healthcare organizations, startup healthcare companies, et cetera, all across the country. But mental health and care is at a premium right now. There's not enough access to patients. Patients don't have access to the care. Talk about how this platform, as you see it, as it evolves, will improve and help these healthcare organizations reach a larger patient population, because that's access, let's face it, is probably the number one challenge facing people with mental health issues in the United States, in my opinion, particularly in rural. You and I talked about rural areas. Can you talk a little bit about how this the impact that this platform will have in patient access? Because I think that's a critical piece to talk about.
I think so. Let's get back to access in just a second, because there's another critical piece that you don't think about when you just think about diagnosis. And there's an old phrase that says, if you can properly define the problem, you're halfway there to solving it. And that's what sort of getting a good diagnosis with a patient spending 10 minutes on a smartphone, that's a pretty amazing thing. But what I think is really even more interesting about Sensei is, once diagnosis is done, what happens? The doctor gives you some kind of drug, or you lay on a couch and talk about your childhood or whatever. Yeah. We don't know if you're getting better or not. It's all, what do I think? What does the doctor think? Am I getting better? I feel better, doc. But tomorrow I'm not so good anymore. The cool thing about Sensei, that is really maybe the coolest thing about Sensei, is you can run a 10-minute diagnosis at the beginning of it. Then you can run a 4.5-minute diagnosis 3-4 times a month to see if you're getting better. And so now the doctor has a feedback loop that says, okay, this drug is working, or this drug is not working, or talking about, the bully who kicked you in elementary school is working, or it's not working. That is the cool thing, because now we will be able to turn it into a real science where we can go from sick to well. And that's going to change everything, frankly.
Yeah, I think you think about Chris Argyris, or Argyris, depending on how you pronounce it, his idea of single loop and double loop learning. Are we solving the right problem? And the fact that this platform is going to be able to not only provide the diagnosis, but also help you track, are we solving the right problem throughout the continuum of care with that patient? That's a game changer, as you just talked about. I mean, that otherwise, as you told me when we talked, and as we've read, it's subjective. Like you asking me, Marion, how do you feel today? Well, I feel okay today. Sun's shining. It's beautiful. I'm feeling. But tomorrow, you're going to ask me the same question. How do you feel today? I don't feel all that great, Michael. Like, there's no measurement of what does that mean? What's the piece there? And I think you just kind of spoke to it. But see, my friend Seal checking in. I know he's also from Texas. He works in the world of AI. He asked this question: how do you envision this kind of platform being integrated into existing healthcare systems? Seal, thanks for that question.
Yeah, that's a great question, Seal, because when I decide to help an entrepreneur, It's because I think the idea is a great one that can change everything. I think the entrepreneur is capable of getting to the finish line. And I think that I have some of the tools to help. And so now let's go back to a little bit of my history, telemedicine. There
Mhm.
is barely a telemedicine CEO in the country who won't take my phone call. Now, I'm not as good as Buzz Aldrin was, but most of them know who I am and what we've done in the teledoc world. And a lot of behavioral health is being done remotely these days. So you don't have to go lay on the couch of the doctor's office. You can do it from your own couch at home. And that is telemedicine. So you asked something about access and remote, and I think Sale put it right in the slot where we can now answer that question, because telemedicine is where we will solve this problem. And because there's AI, it will constantly be evolved. Because cameras keep getting better, we'll get better and better at it. And the the ability to send an app to a patient, they log on, they get diagnosed. 2 weeks later, they test to see if they're improving. That that's exactly how the future is going to work here.
Exactly. Great answer. And by the way, and this is what I love about the Healthcare Thought Leadership LinkedIn Live show. There's always a great conversation going on in the comments. If you're watching live or watching the replay, check out all the comments. Kevin Young and Mark are having a good debate and our discussion around healthcare systems, the current broken state of healthcare systems. Kevin points out,
Yeah,
and how there would probably be some lacking in terms of their adoption. But I think
yeah,
one of the things that you've done, Michael, and this is one I admire a lot of things about you. One of the things I like about you, Michael, is you put the dis and disruption. You've been one of the key disruptors in the world of healthcare. And I think Sensei is one of those things that will continue on that path of disruption. And I knew we were going to run out of time very quickly, our 30 minutes, but Michael, some of my network is in the private investment side, both
yeah.
personal private investment, but also in the PE world, because I work with those type of companies. Michael, how can investors get involved with the future of Sensei? Any thoughts on that?
Sure. The David was smart enough to listen to my advice when I said, bring in the CFO that I had at Teledoc. The man's name is Bill Giles, and he grew up a farm boy in Oklahoma, and he's really good at just patiently listening and figuring out how to solve the problems. And right now, one of the biggest problems in anything that you do FDA is getting the capital raised to get through the FDA process. And Bill and I
Mhm.
have navigated that about 60% of the way through. So we still
Gotcha.
have a little bit more capital raise. I would call it an
Mhm.
opportunity more than anything else. I see on the other side of finishing FDA, which again is now probably less than a year out, there's going to be a lot of revenue flowing from the telemedicine companies that are doing behavioral health. And so it's just a matter of focusing on who can write those checks, who's interested enough in fixing the behavioral health problems. And anybody in your audience that wants to talk to me, I would say reach out to you and grab my email address, and I'd love to chat with them, because this is a real opportunity for the investors, and it's a real opportunity for the future of behavioral health, and frankly, you know, everything else that we're going to be able to diagnose with the Sensei tools.
So excited to hear about that. I know we're going to have you back on the show again, because there's a lot more to talk about. Mark, there's a couple key questions in the chat. Maybe later we can get you to answer for Mark, because we're a little bit
Sure.
out of time. Kevin Young actually appreciated my diss comment, Michael Discord.
Yeah, I wonder if Mr. Young is trying to diss me there.
I don't know. I think he was
I
just
I know Kevin. He's a brilliant man, and he's very clever in using the English language.
Well, good for him. Michael, thank you so much for being on the show. For those of you who are new to the Healthcare Thought Leadership LinkedIn Live show, this is Michael represents episode number 124. I've been doing this for a while. It's on LinkedIn, and I love having people like him, these brilliant people in our network, to share their knowledge. And maybe we can get David on. Maybe we can have another one in a few weeks and talk about that. If you want to get in touch with Michael, if you're in my network, send me a DM. I'll connect you with Michael with his email address. And any of you that are not connected with me, I'd love to get you as part of our network as well. I'll let you go about your day. Thank you so much, Michael, for being on the show. You're so kind to spend some time with me today. And I'm just fascinated. Have a great day. And for those of you who are watching, please click like and share this with your network. And if you're on YouTube, you can find this video on YouTube as well. Have a great day. And we will end the stream. And I hope you have a great week. Have a great day.
All right. Thanks, Marion.
Yes, sir.